go straight to introduction to balance method acupuncture 1, 2, 3. In balance method acupuncture, we have 6 different systems. All right, 6 different systems. Now, tonight I'm going to just introduce 2 systems, and I will focus on holographic theory, because the holographic theory is what most people find difficult to understand. Okay, I will stand up and jump up and raise my hand and feet to show you how you can match the hands and feet all together. How do you choose the point? Okay. Then I'm going to show you how to apply balance method acupuncture 1, 2, 3 to achieve immediate relief. Okay. For extremities pain, as well as headaches, stomach pain, any kind of pain. Now, when we talk about pain, this is Dr. Tan's. When we talk about pain, right? When we talk about pain, pain means any condition that is severe, is obvious. It's a sensation that patient respond to you. Okay, pain including swelling, including redness, including itchiness, including pins and needles, and numbness. So in Dr. Tan's balance method, we call it pain, which is symptoms, are conditions. Okay. Why do I want to say pain? Because pain is something that's very obvious. Okay. We are talking about local balance in this 2 hours. What local balance and global balance, what are the difference between them? I'm gonna explain to you later. So let's see, who is Dr. Tan? So Dr. Tan passed away in 2015. So Dr. Richard Tan, he had 30 years of practice and teaching in Taiwan and USA, most of the time in USA. Dr. Tan specialized in I Ching Bagua. You heard about I Ching Bagua, right? And Chinese medicine and acupuncture. He not only teach acupuncture, also teach feng shui and bazi. So this presentation, I used the old one. I haven't changed it. By the time I set up all this presentation, Dr. Tan hadn't passed away yet. So he was still practicing in America, and I was the one who attended his first seminar in New Zealand. Then I talked to him, why didn't I hear about Dr. Tan's balance method over the years, and why didn't I hear about you in China or Hong Kong, and in the Chinese acupuncture world? And he said he tried. He went to Tianjin and present his acupuncture method, and no one want to know about it. So I said, well, this is sad. Because I said, where did you go? And he said, I went to the hospital. And I showed them. I said, no, you went to the wrong way, because hospital doesn't need more patient. Who want to learn real acupuncture, those acupuncture technique that can present results, especially instant results, that is not in hospital. They don't care about the results. They care about the money, right? They care about the Western medicines rather than acupuncture, because in acupuncture doesn't bring money to the hospital. They only charge $7 for acupuncture, or $10 way back that time. I remember it only $7 or $12 when I was in Shanghai. That was very cheap. So I promised, and I gave my word to Dr. Tan. I said, I'm gonna promote your method in Chinese acupuncture world. So I did. I traveled to Shanghai, to Guangzhou, Beijing, and Taiwan, Hong Kong, Malaysia to promote Dr. Tan's balance method. And I invite Dr. Tan back to Beijing to did his very first workshop. And he was hoping that he was from Taiwan. He was hoping to went back to Taiwan. So I organized it actually, but unfortunately that it happened after Dr. Tan passed away. All right. So Dr. Tan has few books, 5 of them. 5 books in English, and I think in German, in Italy, probably, I don't know, other language as well, and none in Chinese. So 4 books about acupuncture, and 1 is about feng shui. You're able to get it online. This is about me, all in Chinese. So here you go. There's local balance and global balance. So what are the difference between them? I'm going to talk about something about balance method acupuncture. So balance method acupuncture, including local balance and global balance. Now today's topic, we're going to focus on local balance. What's local balance? Local balance, which means it treats those symptoms that is in one places, which means if in shoulder, nothing else, okay? Just in shoulder, that's local balance. Headache, that's local balance. Okay. When are we going to use global balance? If the internal disease, we use global balance. If pain all over the places, then we tend to use global balance. Okay, this is what we do. And the patient come in, is not complaining about pain. It's not complaining about numbness. It's complaining about, I have constipation. I can't sleep. This is difficult to fit in local balance. So we use global balance. So global balance will be able to cover more stuff and treat the entire body, treat the low organs imbalance, right? So this is global balance. Local balance only focus on local area. All right. That's it. Well, high spot of balance method acupuncture. So be aware, I'm talking about the high spot of balance method acupuncture. Balance method acupuncture never insert any needles in a painful area. So if the patient come for lower back pain, you don't put needle on lower back. You put needle on hand or feet or head. You use distal point to present the results, to treat your patient. This is why we said never insert needle in a painful area. Okay, I'm not saying that you can't put needle on the local area. I'm saying that in Dr. Tan's balance method, this method never put needle on the local area, on the painful area. Instead, it choose distal point. But you know, in your practice, do you get result by putting needle in the back pain area? Yes, you do. Well, do you get 100% results? Do you get instant results? That's my question for you. Now, we know if we put needle on a painful area, you get result. That's good. You're happy, patient's happy. What if you don't get results? Now, normally we try cupping, we try heat lamp, heat pack, we try bloodletting, we try massage, tweener, right? More. Think about it. If you don't do any other thing, just acupuncture, would you be able to do anything still with needles, but not when the painful area needling is not working? What we're going to do, we can choose distal point. When you choose distal point, you need to have a system, right? You need to have a system. So this is where Dr. Tan's Balance method powerful about. Now, the second high spot, immediate pain relief. In Chinese, we call 立竿见影. When you put needle in the distal point, you ask the patient, where is the pain? The pain is in the lower back, right? And you put needle in hand or leg, and you ask the patient, where is the pain? The patient will say, well, there's no pain now. Or the pain is much better. And that's what we call immediate pain relief, instant results. Now, the third, this way I added in for this high spot for Dr. Tan's Balance method. Easy to learn, easy to practice, no need hand technique. You don't need to learn 烧山火 or 透天凉. You don't need 烧山火 or 透天凉 to get the results. Why? Over the years, I met a lot of master, and those master probably will do some technique in the hand and the needles and tell you this is tonifying, this is reducing, and you have to do tonifying or reducing or whatever to get results. Well, when a student learn it and they try to get those technique right, and they can't do it, and the master will tell you because you haven't been practiced enough, right? So that prevents the student get results from acupuncture. In some cases, you try to get as good as your master, but it's difficult. But in Dr. Tan's Balance method, the good thing is you don't need any technique. You just insert the needle. That's it. Everyone can do it. That's why I call it simple, easy to learn, and easy to practice. If Dr. Tan can present the result, you can. If Dr. Tan can present the result, I can do it, and you can do it. Right? And everyone can do it. I guarantee you that from after today's 2 hours, you'll be able to present acupuncture with an instant result. Dr. Tan's Balance method is wonderful for internal disease, for infertility, for children, for everyone. Cool. Now someone say anyone can, right? You got answered, okay? Painless method. So it doesn't require stimulation. It doesn't require 酸麻胀痛. You need to get very strong stimulation to be able to get result. No, you don't need to. Just insert needles. That's it. The reason I put it in here, wonderful for internal disease, because most people use Dr. Tan's Balance method for pain relief. And when you just focus on pain relief, you start to think, does it work for internal disease? Yes, it does. It works for diarrhea, it works for constipation, it works for insomnia, anything that you can think of. The next one. Well, what is acupuncture 1, 2, 3? Now, I do have to tell you, acupuncture 1, 2, 3 This concept, 3-step, is the most important that you need to remember today. After today, whenever patient come to you and they say, can you treat blah, 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 I suffer from blah, blah, blah. And in your mind, in your brain, what you think of is 1, 2, 3. Now, when someone asks you about, can you treat back pain? You think about 1, 2, 3. You see what I mean? You're going to ask, where is the pain? The first question. Why do you want to ask this? Because you want to find out where the meridian is. You see, this acupuncture model, it got a lot of acupuncture meridian on it, meridian pathway. And all your diagnose of the sick meridian is your step 1, acupuncture 1. The acupuncture 1 is diagnose the sick meridian. Then acupuncture 2, step 2, you're going to find out the treating meridian. We also call it balance meridian. Based off the 5 system or 6 system of balance method. Today we're going to introduce 2 systems. Now acupuncture 3, point selecting based on step 2. What does it mean based on step 2? Surely the sick meridian is one meridian. The balance meridian, or we call treating meridian, is another meridian. Then the point that where you needle on the balance meridian. You don't needle on the sick meridian. All right? You only needle on the balance meridian, which is treating meridian. This is the concept. So acupuncture 1, 2, 3. 1, sick meridian. 2, balance meridian. 3, point. Your acupuncture point is number 3. Now, what is the difference between Dr. Tan's balance method, acupuncture, and traditional acupuncture? When I say traditional acupuncture, it's where you learn from school. But if your school teach you Dr. Tan's balance method, and that is your traditional acupuncture, then there's no difference. So when I say traditional acupuncture, is where you learn from your school, where other people taught you, other master taught you. So, in the traditional way that you learn the acupuncture, it does not include acupuncture 2. It jumps straight from acupuncture 1 to acupuncture 3. This is why you don't get immediate result all the time, only sometimes. Okay, I'm going to explain that to you. People say, headache. Headache. Which point do you use for headache? Most people will say 合谷, right? What's 合谷? Large intestine 4. Well, this is symptom or disease acupuncture point. So from sick, diagnose to point. Now, in Dr. Tan's balance method, headache, we ask one more question. Where is the balance meridian? And then after we find the balance meridian, we find the point. So we get headache, right? Which meridian does this headache involve with? Maybe 1, maybe 2. Whatever. You're going to find out the meridian, sick meridian first. And then come to 2. Then you find out the balance meridian. Then number 3, this is your acupuncture point. And here. Now, in general, we say headache, 合谷, 1 and 3. You're missing 2. So when you add 2 on it, this is Dr. Tan's balance method. That's it. What does 3 mean? I don't know what you mean. Okay. We keep going. Are you all guys understand what I'm talking about today? So far, are you all follow? If yes, please say yes. If anything that you don't understand, you're not clear about, please say no. And let me know, I'll explain it again. Otherwise, we'll keep going. Quite clear? That's good. Oh yes, I did ask you to place 3 if you see the presentation. Everything's clear? That's great. That's great. Yes, yes. Thank you. Now, we're going to talk about in Dr. Tan's balance method acupuncture, you must meet 2 balance theories. Without this 2 balance theory, there is no Dr. Tan's balance method acupuncture. Okay? So what theory is that? Why Dr. Tan's balance method acupuncture would be able to get instant results? That's all based on this 2 balance method theory. Okay? Number 1 is meridian balance meridian. This is an acupuncture 2, step 2. This is how you get your This is how you get your balance meridian, treating meridian. And then holographic theory balance is the second theory that used in Dr. Tan's balance method. This is in step 3, which is when you choose the point, you want to know where to needle, you need to apply holographic theory. Okay, let's talk about acupuncture 1, 2, 3, one by one. Okay, acupuncture 1 is simple. Find out the 6th meridian based on 14 meridians. So what is 14 meridian? What does it include? It includes 3 yin and 3 yang. So hand 3 yin, and that's good to hear over here. So 3 yin meridian on the hand and 3 yang meridian on the hand. That's 6 meridian, right? Then foot 3 yin and 3 yang. That's another 6 meridian. So that's 12 meridians in total. Then plus 2 meridian and 1 meridian. Then that's 14 meridians. So your diagnose in acupuncture, your diagnosis is easy. You must use meridian to diagnose. When it comes to pain, now if you do Chinese herbs, it's different. You may use 脏腑 diagnose, you may use 三焦 diagnose, you may use 胃气营血 diagnose. Very rare that you use meridian to diagnose in Chinese herbs. Yes, you do have Chinese herbs and say, wow, this is headache on the yang ming, and then you put some 白芷 to treat yang ming headache, and headache on the neck pain on the Tai Yang meridian, and use gergen for gergen, the herbs of gergen for Tai Yang meridian. But this is only some cases you will use meridian to diagnose in Chinese medicines. But in acupuncture, you must use meridian to diagnose. Meridian is the most important, and this theory you must use an acupuncture. If using acupuncture, you're not using meridian to diagnose, this is not acupuncture. All right. So do you all get me? Anything that you can see, all the meridian over here, that is your step one. That's the acupuncture one. When patient come, you always ask a question and they say, "Oh, I have back pain." You need to ask, where is the pain? Can you please use one finger to show me the pain? Let's say if patient use the palm to show, they say, my pain is over here. Can you tell the meridians? Not really. There's a lot of meridian in here, right? So the patient say, you say, can you please use one finger to show me the pain? The patient will hit pains over here. What meridian is that? Bladder meridian. That's good. But if the patient said pains over here using palm, how many meridian in here? It's not clear. It may be few meridian, UB and 2 meridian. Right, there are 2 meridian. If you use one finger, if the area is bigger, the patient will use one finger and it will go like that. If the pain is just one spot, the patient will go just like this. So you'll be able to see very clear where the patient point out and which meridian involved with the pain. Does it make sense to you? Okay, thank you. We're gonna go step. This is acupuncture 1, 6 meridian. Good question, Martin. What if the meridian, what if the problem, the pain is between meridian? Let's say, if the pain is over here, this is large intestinal meridian. So your acupuncture 1 is large intestinal meridian. If the pain is over here, this is lung meridian. But if the pain is between lung and meridian, and your diagnosis is at between lung and large intestinal meridian. Okay, so not all the pain on top and it will be on exactly on the meridian, and maybe at between meridian. Then your diagnosis at between meridians. Do you get me, Martin? Great, thank you. Now, we're gonna talk about, I know we talk about acupuncture 1, 2, 3, right? How do we balance sick, do, and run? Run, balance, do, balance, run. Now, I know we talk about acupuncture 1 now, then we're gonna talk about acupuncture 2, right? I'm gonna jump over. I'm gonna talk about acupuncture 3 first. Then we talk about acupuncture 3 because acupuncture 2 is so simple. It's so simple. Now, the most difficulty for you to understand, for you to get it, when you're in the practice, most people find it difficult to find the point. It's very difficult to see how the holographic theory apply on here. Okay, so I'm going to spend most of the time on acupuncture 3, selecting the point. So acupuncture 3, locate RC point. We talk about RC point. RC point on balance meridian. Okay, treating on local balance, treating pain condition, you'll be able to get instant relief for 95%. So I'm saying 95% of pain in your clinic, you should get 95% instant results with Dr. Tan's balance method. What about the other 5? The other 5, because most of our clinic, my clinic, I don't see all pain relief mainly for those structure change. Dr. Tan says This method is not 100% for everything. For pain relief, for general pain relief, it's good. But when it comes to structure, not as good. Okay? What is the structure issues? Torn ligament, the muscle tear, the ligament tear in the ligament. Those are not this acupunctures will be able to help. It can help the pain, but the pain came back quickly. Okay? Those patients need for surgery, they need to surgery. Need to go for surgery. Now, lumbar disc herniation, prolapse disc, those are structure change. So in Dr. Tan's balance method doesn't work as well as the other general pain. Okay. Don't get me wrong. I'm not saying Dr. Tan's balance method couldn't treat lumbar herniation disc issues. I have successfully treated lumbar disc herniation for my patient using Dr. Tan's balance method. But I have to be honest to you, not all the cases. That is why I keep learning for other methods of acupuncture to help on top of Dr. Tan's balance method to treat structure issues. Number 2 thing is ear problem, tinnitus, and hearing loss. This is not a kind of conditions that a kind of disease that Dr. Tan's balance method work well for. Dr. Tan himself suffered from tinnitus and hearing loss. That was because he was young and he was in the army and the bomb in front of him, and then he lost his hearing. And then when it got better, and then when he was on he was getting older, and then that started again. And he tried to use Dr. Tan's balance method acupuncture for himself. It doesn't work as well. Okay, so he said it's not as good. But I do have to tell you, I used Dr. Tan's balance method, global balance, to treat tinnitus and hearing loss successfully, plus other methods. Okay, I may be able to share with you other times. It does help, but not for every cases. But I do have to be honest, for any other acupuncture method, when it comes to tinnitus, it's a difficult one. Now, if you can't hear anything, can someone help? Someone say that he can't hear, she or he can't hear anything. Can you guys still hear me? If you can, please type yes. Great. Good, I still have you guys. Now, number 3 things is overuse symptoms. If the person come to you using hammer all the time and suffer from wrist pain, and this pain is when they use hammer and they start to get pain. If they don't use it, they don't get pain. In our idea, they need to change the job. They need to stop using it for a long time with treatment. Then they will get recovered, and then they can go back. They might not be able to go back. They have to change the job. Okay, that's overuse symptom. And overuse symptom, I use other method too, and that some overuse symptoms is very difficult. They really need to change the job. Some are easy to treat, not for every cases. Okay, so Dr. Tan said his method doesn't work as well for overuse symptom. Okay. Now, local balance, treating pain conditions, immediately results, right? So we have global balance. Global balance has a lot of global balance pattern that is about 12. We have Bagua meridian conversion, Bagua seasonal balance, Bagua 5-element balance, and 12 meridian balance, which makes it go 12. This all an global balance. Okay, we're not talking about those. We're only focus on local balance. So what is R point? The real R point, right? If patient tell you I have back pain, I know in your mind, R point is back pain in here. You're gonna get your finger to here and looking for the most sensitive one, and then insert needle there. When the most sensitive point in here, you get 1 or 2 points, and the patient say, this is the point, and you say this is the R point, right? This is the way that you do acupuncture, right? This is one of the R point. Another R point, which we call the real R point, is actually locate R point on distal area for far away from the painful area by using your fingers. If pain in here, we go to here, leg, to get the R point over here, needles. Or pain in here, we come to the head to get the most sensitive one, needle. Or go to the hand to get the most sensitive one and needles. If Safari have a problem to run webinar, better use Chrome and no problem. Oh, funny, because I use Safari on my cell phone, no problem. Of course, no. When I say just quit the job, I'm not meaning you really ask the patient to quit the job. You treat. If you don't get good results, if you just use Dr. Tan's balance method, you really need to get the patient to change the job. But for us, we actually try other methods to see whether those are working better or not. So you have a lot of options. I personally use a lot of different methods. Okay, not just balance method acupuncture. Okay, what do you want me to repeat, Kimberly? You may be able to the points. Okay, we haven't ever talked real about the point yet. We just introduced what's R point. R point is if pain in here, you come to the lower back to get the R point, a needle. That's one type of R point. So, but in balance method acupuncture, the R point, it doesn't mean you come to the painful area. It is actually mean you go to the distal point, distal area, pain in the lower back, you come to here, you get the R point from here and needle and get result from here. Or if it's on the head, you get the R point on the head, needles, and you get result from here or on your hand. Okay, this is what I mean. Thank you. Now we're going to introduce acupuncture 3, selecting the point, right? 2 basic format. One called mirror format, the other one called image format. Let's talk about mirror format. What's mirror? Apply on 12 meridians. Apply on limb, which is hands and leg. Apply mirror format to find R point when treating painful or sick meridian on hands and legs. Okay. Now, mirror format only used on 12 meridian, only used on hands and legs. Okay. Hands and legs. So 2 meridian and learn meridian do not run on hands and legs, right? So this mirror format only apply on hands and legs. Okay, I'm gonna show you what that means. Now, a mirror format, you really want to know to find out the first thing is the center point, the center joint. Okay. Please don't ask question first. We're gonna give you some time in the end, and because if I read your question and I can't present this workshop properly, okay, that's step by step. I'll leave some time for you to ask question. Okay, acupuncture 3, mirror format. You're gonna find the center point. Okay, you can go through the presentation. Elbow and knee are the middle, are the center of your leg and your hand. And you go down, the next joint. On the bottom joint is the wrist and ankle. So wrist can balance ankle. And between your wrist and elbow is forearm. Between your ankle and knee is lower leg. So forearm treat and balance lower leg. So hand treat foot, finger treat toes. Now in the upper joint, above elbow, the upper joint is shoulder. Above your knee, the upper joint is hip. And between knee and hip, that's thigh. Between elbow and shoulder, that's upper arm. So upper arm, balance, thigh. Do you get me? Sarah Wood? That's okay, no problem. Can you repeat the question in the end of the seminar, webinar? Thank you. Great. Now, reverse mirror. Okay, as you can see, elbow and knee never change, middle. It always balance each other. So when you treat patient, when patient come in front of you, before you put needle, you want to go to, you know the balance meridian already. You know sixth meridian, and you know balance meridian. Now you're going to get the point. You're going to go to elbow and knee first. Locate the elbow and knee, and then find out the other point, how they balance it. Okay. What's, you probably can see me, right? So if this is my hand, this is my left hand. If my left hand put it over here, here is a mirror. And in front, you put the hand in the mirror. This is thumb, and that's your thumb, right? And this is what? This is my left hand. And in the mirror, this is right hand. That's what we call mirror. Okay. Now, you can still see me, right? So when acupuncture, I need to lower a little bit. Okay, here you see, this is our position. I'm standing here. This is acupuncture main position, right? Elbow is the middle. Can treat the opposite elbow. Okay. Now this is, we talk about mirror format. We're not talking about reverse yet. Okay. Elbow to treat the opposite side of elbow. The wrist to treat the opposite side of wrist. Palm treat palm, fingers treat fingers. Shoulder treat shoulder. Okay. Then between shoulder and elbow, upper arm. Treat the upper arm between here and here. You get me? Forearm, treat forearm. Okay. Now this is the left hand, treat the right hand. Now we're talking about reverse. What is reverse? This hand maintain the position. This hand, which is my right hand, raise up. This is the difference. But the middle, the center point never change. The elbow of this side still maintain middle. And this side, the position change, but the center point still the same. Okay? So, but the wrist now is on the upper joint. It's above this joint. It's above elbow. So the above joint, treat the above joint in here. This is the center. Which joint above this side of the elbow? Shoulder, right? So the upper joint, treat the opposite side of the upper joint. So now your wrist be able to treat your shoulder. That makes sense to you? Now this side of joint, shoulder joint, is lower than your elbow. So the lower joint on this side, treat the lower joint of the other side. So this joint, which is wrist, the left wrist joint is lower than elbow, lower than center on that side. So this lower joint, treat this side of the lower joint. So that's how you treat. Simple. I'm going to do this. This joint on reverse, it treat this joint and treat this. And elbow, treat elbow. Then at the moment, the forearm for here, I can treat the upper arm of the opposite side. Can you understand that? Now, if my pain, very nice explanation. Okay, great. Thank you. Kiwan, Dr. Kiwan, how are you? Okay, see, if the pain is over here, where can you treat it? You can treat on the opposite side. If pain in here, pain in neck one, let's say, pain in neck one, you can treat over here, right? Because you see, this is one option that you can choose the point on this area. If the pain over here, if I don't want to needles here, or if I needle here, the result is good, but I want even better results, I can go to here. Then I can treat here. So when you're selecting the point, this is the first option, this is the second option. You always have multiple areas to choose the point. This is the beauty of Dr. Tan's balance method, because we're using reverse format. Does it make sense to you? Now, when you needle, when the pen is over here, I love Dr. Tan's balance method because it opened my mind. It gives me a lot of ideas where to needles. Now, if you happen to needles painful area, if you needle here, it doesn't work. Where do you go to? You use cupping, you use massage, you use twinner, that's okay. But what if I use needles on the other side, on the distal point? If I use needle on the distal point, for this example, I can needle in here. If that doesn't work well, I can needle here, because this area can balance this area. If this doesn't work well, I can also needle here. If this doesn't work well, I can needle my legs. If that's my leg, I can needle my legs over here. And my legs over here. Or the other side of leg over here and here. Can you see the opportunity that how many places, how many areas that you can needles in Dr. Tan's balance method? This is beautiful. This is amazing. And this is wonderful. Okay, up to here. Do you follow? Are you following me? Say yes if you're following me. Say no. I don't know what you're talking about. You're allowed to say no. Don't be shy. Great, thank you. Okay. Now, we're talking about hand and hand, right? Legs is the same. I'm not going to repeat. I'm not going to tell you about the legs to legs, okay? I think you can get the idea how leg to legs, okay? Now we're gonna talk about reverse, right? We finished the reverse, but I haven't talked about how hands and legs. Okay. Let's go to the presentation page. Can you guys still see the presentation, the video image here? So I need to tell you that this image, I didn't create it myself. It's from a guy from Brazil, Alex. So Alex created this picture. And this is a great picture. And I'm going to show you in here about legs, the reverse one, okay? Ask me that question later on. Rachana, thank you. Now you see reverse. Let me show you reverse. I asked permission from Alex that whether I can use his image on my presentation, and he said yes. That was years ago. I'm not sure whether he still allowed me to use it, but I use it anyway. So you can tell him if he doesn't want me to use it anymore, you let me know. But I did ask him. He's a good friend. It's a good mind. It's very general. He created a lot of picture and Tan's Acupuncture and Dr. Tan's Acupuncture. All the images that he creates is all beautiful. I love it. We appreciate that Alex allowed me to use this, and thank you to Alex. Okay, that you see here, we're gonna see about reverse of the hands and legs. Okay. Way back. Let me see. Okay, this is reverse. You see the girl over here. This is the. Let's talk about hands. Okay. Elbow and knee. Elbow and knee. Okay, let's talk about here. Look at here. Look at the girl, okay? Knee treat knee. Because both knee are in the center. Then the lower joint is ankle. Both ankle, lower joint. So those two treat each other. And the upper joint, above the knee joint, they are hips. So hip treat hip. Then what happened in between? Thigh treat thigh. Lower leg, which is calf, treat calf. Now what's the reverse? Here's the reverse. I'm going to show you. Here's the reverse. You see hand. This is reverse over here. Ankle treat hip, ankle treat hip, and knee center always treat center. Okay. Then let's have a look. Leg and okay. Hand treat leg. Elbow treat knee. Wrist treat ankle. Your forearm treat calf. Your thigh treat upper arm. Then shoulder treat hip. If you think about it, if someone hasn't got his hand, they use their legs to eat, to do everything, to brush teeth. Their legs are their hand. If someone hasn't got legs, they only have hands. They use their hands to walk instead of their legs. It's blue line. Yes. This is a mirror format. Okay. We're gonna talk about reverse format of hand and hand treating legs, leg treating hand. It's over here, the red line. Knee and elbow always in the center. Okay. Then at the moment, the hip treat wrist. And this ankle treat shoulder. If on this is the reverse, the red color, the red line. Then the thigh over here treat the forearm. Okay. The calf treat upper arm over here. Okay. So this is reverse. You may be a bit confused in here. Don't worry. After this class, if you just use mirror format, you don't use reverse, and that's okay. And you come back later on to get, if you get a bit confused, don't worry, don't stop in here, just follow me, keep going, and then you get into it afterward. I'm gonna send you those this presentation, and I actually recorded, and I can put it up on a platform. I don't know where to get put it up yet, and I will do that, and I'll send you an email, and you can rewatch it again. All right. We're gonna talk about image format. Well, image is actually easy, right? We talk about mirror, right? Mirror is hand balance hand, hands balance legs, legs balance hands, right? An image, we're talking about 14 meridians, which including Luân Mai and Tu Mai. An image format. We are using hands and legs to treat trunks and to treat head and face. This is about image format. Okay, so it's just a name, image and mirror. It doesn't matter about this name, as long as you know which area treat which area. Okay, navel, which is belly button, treat elbow. Belly button is the middle of the trunk. The head, eyes, are the middle of your head. So when I say eyes, eye level, even in here and here. Okay. When I say belly button, I come to here, this level, come to L2, 命门 or 肾腧. Okay. So let's see. The pelvic area, the pelvic level, it can treat the shoulder. If the pelvic level over here, then that can treat shoulder or wrist. Okay, so this is the middle. I'm going to show you this. It's easier. This is the middle, right? My elbow. And the top of my hand is my shoulder. Okay, the top is my shoulder. Then my eyes is the middle. The top is here, top head, which is 百会 level. So 百会 level treat here. And in my leg, this is knee. The top area, the top joint is hip. So hip treat here too. This in the trunk, belly button is over here. The top of the trunk is your neck. So neck treat here. This can treat neck too. And hip can treat neck too. So the bottom joint of the legs is ankle. Hand is wrist. The bottom joint of the legs is ankle, right? The joint below knee, the joint below elbow, wrist and ankle. So wrist and ankle can treat chin over here. This is the middle. This is the lower part. Okay. On the trunk is Hui Yin area, pelvic level. And we do reverse. Now this trunk is different. But the belly button is still the same. Right? Look at that. My hand hasn't changed position yet. The top, the middle, still elbow. My leg, this is my knee, still in the middle. Knee, elbow, still treat belly button and eyes. So even though this trunk has reverse, this head reverse, the bottom of this head is 百会 area, 百会 level. Then my hand over here, the bottom joint is wrist. My leg, the bottom joint is ankle. So ankle and wrist is my bottom joint now. So ankle and legs can treat 百会. And the trunk, the neck is on the bottom now. So neck, those can treat this level, neck level. Now my upper joint on my hand, that is still shoulder, because shoulder joint is above middle joint, which is elbow. My hip is above knee joint. Knee joint is central joint. So this is upper joint, this is upper joint. So those joints are shoulder and hip. Shoulder and hip joint are the upper joint now. So have a look on the trunk. Belly button still in the middle. So instead of neck, the pelvic area is the upper area now. So pelvic area, balance, shoulder, and hip. The chin area is above eyes area now, the eye level. So chin here, it can balance here, shoulder and hip. Does it make sense to you? This is reverse. This is reverse. Can you understand it? So I don't talk about the between because the between is simple. Getting confused. That's great. Okay. Are you saying you're getting confused in reverse? Lucy is good. Mignon is good. 7. So one person getting confused. What about the others? We have 69 people online. Welcome on board. Confused with reverse. I know you're going to be confused. How about the others? It's clear. That's great. Confused with reverse. A bit confused. It's simple. It is all good, Aaron. Hi, Aaron. How are you? Now, I know it's going to be confused when it comes to reverse, but I will let you know. Don't worry about reverse. On Monday, when you start in your practice, don't use reverse. Reverse is the second idea for you to choose the point. You don't need to use reverse, to be honest. And then I'm gonna send you the you can rewatch it because I want to make sure that you get something out of this tonight. Okay, so if in the end, if we have time, we're gonna talk about reverse again. Is it okay? We're gonna carry on. We're gonna carry on because we're gonna talk about acupuncture too. Okay, so remember, you must have the idea that acupuncture 3 is selecting the point, and you only use image format and mirror format in acupuncture 3, selecting the point. Okay, don't mess up that. Okay, now the next step is acupuncture 2. I know we talk about acupuncture 1 first, and then we skip acupuncture 2. We talk about acupuncture 3 first, second. Now we're gonna go back to acupuncture 2. How to find the balanced meridian. Thank you. Now, this is reverse. Doesn't matter. We cover this. We cover this already. We can come back and talk about the picture over here. Okay, acupuncture 2. Find the treating meridian, balanced meridian through 6 systems. Okay, we have 6 different systems. Okay. System 1, Chinese meridian name sharing. System 2, Beijing branching meridian. System 3, this is wrong. System 3 is Biaoli meridian. System 4, Chinese clock opposite. System 5, Chinese clock neighbors. System 6, origin meridian. So we're going to introduce only system 1 and system 3 today, which is Biaoli and Chinese meridian names sharing. Now, look at the principle in here. If you read 黄帝内经, okay, 黄帝内经 said about use yang to treat yin, use yin to treat yang. Okay, but in this principle, we use yang to treat yang, yin to treat yin. Okay. Second principle, hand to treat foot, foot to treat hand. Okay, what does it mean? In 黄帝内经, it said about when the problem is in the top, you treat the bottom. When the problem is the bottom, you treat the top. So hands on the top, legs on the bottom. Top and bottom. You know, hand meridian, foot meridian, top and bottom. Does that make sense? Principle 3. Needle the opposite side. What does it mean, needle the opposite side? The pain on the right side, you needle left side. The pain on the left side, you needle right side. 黄帝内经 said, use right to treat left, use left to treat right. So those are all principles from 黄帝内经. Okay. Again, this is on Acupuncture 2, Step 2, System 1. On Step 2, Acupuncture 2, we have 6 different systems. We're going to introduce 2 different systems tonight. Now, when I was studying in Chinese medicine in Shanghai in Meridian, and I was frustrated because I have to learn the long name of meridians. I was thinking, why don't we just say stomach meridian, that's it. Lung meridian, that's it. Why do we have to study and memorize foot yang means stomach meridian and hand tie in stomach meridian? And I met a lot of people who study. I met my wife in Shanghai, and Aaron know that, right? I knew Aaron, and I met Aaron in Shanghai too. So my wife didn't get it, and I didn't get it either. But in the exam, we had to write the long name. Way back then, we didn't know why do we need to do this. You know, we just know this is the name of it. But in our clinical, we don't use it at all. We went to hospital and we follow the master. No one, there wasn't anyone guide us and said, well, we're using this acupuncture method is because we have the theory of the long name of the meridian. Okay. Not until I met Dr. Tan. And I realized whatever I memorized in the past, it's actually useful. This is in this meridian. I'm going to show you. Now, we use yang to treat yang, right? Sao yang to treat sao yang. Tai yang to treat tai yang. Sao yin to treat sao yin. Tai yin treat tai yin. Jue yin treat jue yin. Tai yin treat tai yin. We change the foot and hand. If acupuncture 1, 6th meridian is on hand sao yang, then acupuncture 2, the balance meridian, we still use sao yang, but we change the hand to foot, which is foot sao yang. Do you get me? Another example. If pain in hand sao yin, this is acupuncture 1. Diagnose hand sao yin. Then acupuncture 2, balance meridian. is foot sound in. Now, hand sound in heart meridian, foot sound in kidney meridian. So kidney meridian can treat heart meridian. So no, I know if you first time listening to my class, Dr. Tan's balance method, you may be confused because you haven't been memorized the long name of the meridian. You probably just go for lung meridian, heart meridian, pericardial meridian, and you forgot about the long name of it. Now, it is a time for you to get it back. You don't have to do it now, but after this, you have to memorize the long name of meridians. So what is the theory behind that? I'm going to let you know. Now, Shaoyang family have two kids. One kid's called gallbladder. The other kid's called Sanjiao. One kid who called Sanjiao stay in hand. The other kid's called gallbladder live in the foot. So it called foot Shaoyang gallbladder meridian. And the other one called hand Shaoyang Sanjiao meridian. Now if Sanjiao is sick, then gallbladder meridian is going to help. If gallbladder meridian sick, Sanjiao is coming to help. Just I have my last name called Phua, and my brother live in Malaysia called Sihan. So Sihan is a member of Phua family, live in Malaysia. Szenan is a member of Phua family, live in New Zealand. So, but if Sihan has any problem, I would help. If I have any problem, Sihan would come and help me. That simple it is. They come from the same family. They share the surname, the last name together. The surname of those meridian, if they are the same, they can balance each other. So Sao in, balance Sao in, Tai in, balance Tai in, but both Tai in live in different places. Does it make sense to you? One live in hand, one live in foot. So for now on, you need to remember all the long name of meridian. Good example. Thank you. Thank you. Now, are you following? This is system one. Simple. Now, your little test. A patient comes. I have back pain. How do you treat back pain? Now, I need your answer. When I ask how do you treat back pain, your answer is standard answer is 1, 2, 3. Why I want you to say 1, 2, 3? Because you're gonna follow where is the sixth meridian, what is the sixth meridian, what's the balance meridian, and what is the point. You're gonna follow 1, 2, 3. You're not gonna jump to 1 to 3. Okay, so 1, 2, 3. So how do you treat back pain? Type it for me, 1, 2, 3, please. Well, we have 70 people in here. Thank you. Now, how do you treat headache? 1, 2. That's not right. It's 1, 2, 3. Thank you. Thank you for engaging with me. That's great. How do you treat ankle pain? It's 1, 2, 3. Always go for 1, 2, 3. Thank you very much. Now, this is a little test. If the pain is in here, so I said, I have a back pain, the patient asked. you're gonna ask, where is the pain? Can you please use one finger to point out for me? The patient point here. So what is the 1 and 2? Can you type 1 and 2? Great. Aaron, I know this is hand tai yang is 2, right? So this is the lower back. I don't need your 3. I just need 1 and 2. 1, your diagnosis, bladder meridian. What about 2? Can you show me 2 on system 1? What is your answer on system 1? Acupuncture 2, balance meridian. This is bladder meridian. Bladder meridian, long name of the full name of bladder meridian is foot tai yang bladder meridian. Great. Small intestine, that's right. The acupuncture 2, we use tai yang to balance tai yang. We use hand to balance foot. So hand, tai yang, small intestine meridian. Okay. Now, if the patient pain over here, now I'm pointing stomach meridian. So what is your acupuncture 2? Now acupuncture 1 is stomach meridian. The name of stomach meridian, the full name of it called foot yang means stomach meridian. And what is your acupuncture 2? System 1. Great. Tan Tan said it's large intestinal meridian. That's right. Yang Ming. Hand Yang Ming. Hand Yang Ming. That's right. Correct. You guys are awesome. Now, another one. If the pain's over here, this is lung meridian. On the right side. Now, acupuncture 1, 6th meridian is lung meridian on the right side. Yeah. Acupuncture 2, the balance meridian is Zhu Tai Yin spleen meridian. That's good. Foot Tai Yin spleen meridian. If this is on the right side, which side do you treat? The opposite side. On the left side. Okay. That's right. System 1 always use the opposite side. Okay. Now we have 6 different systems. You may be able to find it online of those 6. And I'm going to help you to memorize which system treat the opposite, which system can treat both sides. So 1, 3, 5. 1, 3, 5. Always treat the opposite side. 2, 4, 6. You can treat either side. Great. Thank you. Now the next one. You see in this presentation I have acupuncture 2 system 2, but I'm not going to talk about system 2 today. I haven't got time. I only plan for 2 systems. So next system is Biaoli system. System 3. Now 1, 3, 5. Treating the opposite, right? So the 3 principles in here. Principle 1, yang balance yin balance yang. We change in yin yang. Number 2, we use hand treat hand, foot treat foot. We don't change foot and hand, okay? Number 3, yes, we treat the opposite. Use right to treat left, left to treat right. Okay. Now, yin to treat yang, yang to treat yin, that's still a principle of Neijing. Now, Biaoli relationship 表里 interior and exterior pairs. I don't think I need to talk much about this because most people know about this. Any of you don't know about 表里 relations of the meridian and 脏腑? So it was painful when I memorized in the school because I didn't know. Because we have to talk about it all the time. That's why I remember. Now, in the end, I actually found out how it actually called 表 and 里. Okay, I'm going to explain to you. This is the thumb. If you can see, this is the thumb. This is the little fingers, right? This is the middle fingers. The 3 meridian over here run through your thumb. It's called 太阴. The meridian run through here in the middle. It's called 厥阴. The meridian run to the little fingers. It's called 少阴, right? Flip over. The yang meridian run through here, called 阳明. Run through the little fingers, it's called 太阳. And between 太阳 and 阳明, that is 三焦. It actually runs through the ring finger, right? So we have thumb side, little side, and middle, 3 different meridians. Let's see the opposite one. The 太阳 meridian over here, which is small intestine, right? What is the opposite one on the other side, on the in aspect? Heart meridian. So heart and small intestine are 表里 relationship. This is over here, close the meridian closest to the thumb, 阳明, large intestine meridian. Okay, run through here, 阳明. Over here, this is lung meridian, 太阴. So lung on the thumb side of the yin aspect, on the thumb side, on the yang aspect on the thumb side, both are large intestine and lung meridian. So they both are 表里 relationship. They both can balance each other. In the middle, pericardium meridian, and between those 2 yin meridian, that's in the middle. 三焦 meridian, 少阳三焦, hence 少阳三焦, on both meridian here in the middle, between those 2. So this middle meridian, 三焦, can balance 心包 pericardium meridian. This is how I match up the theory of that, why they can balance each other. This is my way to understand it. Because you can't go for 少阴, 太阴, 太阴. It doesn't match up of the last name of the meridian, the family name of the meridian. Does it make sense to you? Do you get? Are you following me of system 3? If you are following, please say yes. Thank you. That's it. Great. Great. So we have about 20 minutes before we finish. Great. Thank you. All right. Thank you. A lot of people say yes. In this chart, you have system 1, system 3, right? You can see it. Or 1, 2, 3 from lung to liver meridian. All 12 meridian over here. The blue color over here is sick meridian. Then this is acupuncture 1, blue color, sick meridian. Then acupuncture 2 is you can use system 1, system 2, and system 3. So I don't have time to talk to you about system 2. But hey, just get familiar with system 1 and system 3. I'm sure you get good result from that. Then I'm going to send you the presentation. So you go for system 2. You learn those on system 2 yourself, okay? System 1 and system 3. That's good enough for now. Before I finish, I need to talk about something in here. Then I'm going to give you some more tests. Let's talk about tests first. Right. Little test. I want you to tell me the system 3 this time. Okay, acupuncture 1, 2, 3, right? If the pain is over here, which is spleen meridian. Your acupuncture 1 sick meridian is spleen meridian. The acupuncture 2, I want you to type out system 3. System 3. 表里 relationship. When you type it out, you need to let me know which side to needles. That's good. You're all correct. Which side to needles? This is the right side. Yep, opposite side of stomach meridian. That's great. Left side. That's great. That's great. And some people say about lung, you're right too. You're right on system 1, but not on system 3. But hey, if you needle lung, you are still right. Okay. Right. Now, what about system 1? What about system 1 for this one? You know system 3 now, stomach meridian on the opposite side. What about system 1? Lung meridian. Which side is that? This is still on the right side? Great. Now, you see it's simple. If the patient had pain over here, right? What is your option right now? Let's say if patient pain is on the... Now you have lung meridian, right? If acupuncture 1, pain is about 大横, which is spleen meridian on your right side. This is acupuncture 1, your sick meridian. It's on spleen meridian on the left side, level of belly button. Then your acupuncture 2, you just type out it's lung meridian on the left side, right? Now, what about acupuncture 3? Which area do you treat on acupuncture 3? Type about which area do you treat on acupuncture 3. This level is go to the same level of belly button. You choose the left side, lung 5, elbow. I never studied acupuncture point on English, so I hope lung 5 is elbow point, right? It's called 尺泽. Must be 尺泽, right? Lung 5. That's great. 尺泽. Lung 5. Okay. I believe 尺泽 is lung 5 then. I don't know about the code of in English. That's great. That's great. Thank you. Now, if you use system 3, where about the point? Thank you. Wait. Thank you, Amit. Dubi, that's right. Dubi, knee, stomach knee, that's right. No, Kiwan, we're talking about system 3. Dr. Kiwan, we're talking about system 3 on stomach meridian. No, spin meridian. It should be the opposite side of knee of stomach meridian. You got it right. That's good. So tell me, is it simple? Is it simple? Are you following? If you think this method is awesome, please type 1. Awesome. Thank you. Awesome. That's good. Thank you. Now, I'm gonna let you know what other opportunity now. It's gonna be on me. Now, if I coming to you and say, hey, I have pain in my elbow, and you're gonna ask, what's the question? How do you treat elbow pain? How do you treat elbow pain? That's right. 1, 2, 3. The standard answer is 1, 2, 3. Okay. How do you treat lower back pain? 1, 2, 3. That's good. 1, 2, 3. Now, thank you very much. 1, 2, 3. Now, if I tell you I have pain in my elbow, now you're gonna go through, wow, elbow pain, right? You're gonna ask the patient, can you please show me where is the pain with your 1 fingers? Now the patient's gonna, if you don't tell the patient show 1 fingers, show you by 1 fingers, the patient's gonna say like this, I pain over here. Can you see the meridian? Yes, a lot of meridians. Okay, if I gonna give you 1 fingers, gonna show you on 1 finger, I saw in here. You see, this is my elbow, but I show over here. For me as a patient, I don't know which elbow pain. I just say arm pain or elbow pain, but I actually point over here. So now your acupuncture 1 is left side of what? Left side of large intestine meridian. Okay. Now system 1. Let's say system 1. System 1, we are using acupuncture 2. We're gonna find the balance meridian. System 1, which meridian is that? Can you type out for me, please? And which side do we treat? Yep, stomach meridian, that's good. Opposite side, that's great. Great. You all got it. The right side of stomach, right? This is acupuncture 2. Now acupuncture 3. Where is the point? The pain over here is below elbow. It's below elbow, right? And elbow is the middle point. Below elbow is about so uli. I don't know the name. So uli. So sanni. Sorry. So sanni. And we're gonna use the opposite side. I'm gonna bring my legs up. There you go. This is my leg. So this is the opposite side of my leg. And this is Yang Ming meridian, stomach meridian on the right side. Right. Where are you going to treat it? Stomach 36, right? That's right. But you don't needle stomach 36. You actually needle on the Asu point. Get to the Asu point. Get your hand. Use firm pressure. Each point you point at, you're going to be equally firm. Okay? Use the same pressure. You get the most sensitive one, needle it. That's it. Okay. Let me ask you a question. If before you learn, let's say if you haven't, before today, you didn't learn about acupuncture 1, 2, 3, right? You will needle here. I'm not saying this is wrong, okay? If you get good result, that's good. If you didn't get any good result, you miss out the result from here. What can you do now? You can needle Susanni on the opposite side, right? So you have one option, two options. If unfortunately you didn't get result from here, or the result in here is not as good, what else can you do? We do reverse. What is reverse? Reverse over here. You know, this arm's going to be reversed. You can treat here, which is Liang Qiu, above Liang Qiu over here. Above the knee, on the same meridian. This is option 3. Yep. No, up on the thigh, not the arm, because we still treat the stomach meridian. So in this case, the same meridian, you can use mirror and reverse mirror. Reverse mirror. Okay. Stomach 25. I don't know. It's about, now we talk about the point, right? It's Liang Qiu. Or Yin Si. I'm sorry, Yin Si. The other point about around here. Okay, should be Yin Si. So other point, this is the third option. But let's say you didn't get the luck. There's no lucky for you today. You didn't get any results. Or the result's not great. You didn't get 100% pain relief. What else can you do? Repeat acupuncture 1, 2, 3. You needle what you ask patient, where is the pain right now? Ask the patient to move. If I'm the patient, I say, well, the pain's still there. You say, bummer. I didn't get it. But anyway, you repeat acupuncture 1, 2, 3. You ask the patient, where is the pain right now? The patient gonna show you it's the same. Or sometimes the patient say pain still there, but they actually point out here. The pain is actually not under stomach, large intestinal meridian now. It's probably in here. Okay, but in this case, it's still in here. Now, you first make sure that the 6th meridian is still the same, right? Then what happened now? Go to the acupuncture 2. We use system 1 already. Now we use system 3. So what is system 3 now? 6th meridian still in large intestinal meridian. System 3 is, that's right, lung meridian. Which side? Opposite side, right? Lung meridian. So this is the number 4 idea. So another idea, another area for you to needles, which is over here. The pen's over here, right? Now you're gonna needle over here on the lung meridian on the opposite side. You can get the answer point. Let's say if this doesn't work, where are you gonna treat it? Bend over. You're gonna treat over here. Bend over here. You're gonna treat over here. Okay. So you see, elbow, still elbow, pen over here, right? And this come to here. So on one meridian, you actually have 2 places you'll be able to needles. So in this case, you can needle here, which you normally do, but if it doesn't work, where can you needle? You can needle 1, 2, 3, 4, and 5. 5 different areas. So Dr. Tan's balance method gives you 4 more options, 4 more acupressure point, answer point for you to needle. Don't you think this is amazing? Don't you think this is wonderful? You don't have to do massage for another half an hour. That's awesome. Yeah. Tell me about it. Belinda. Fantastic. Yes. Tell me about it. Yes, and simple. Yes. Amazing. That's right. Amazing. That's right. Well, this is my presentation today. I'm so happy to show you what I know, my knowledge. This is so simple. I hope everyone get it. I'm actually recording this webinar, and I'm going to put up a platform, and I'm going to send. When you log into this webinar, you actually have giving me your you give me your details and an email address. I'm going to send you an email and let you know, give you all this recording today that you can rewatch again, and then I would like you to rewatch it again, and then I would like you to join our Facebook group so we can discuss further if you have any question. And I hope, I'm so busy I won't be able to answer any of your questions in the future. I may be able to do some answering your question, but I know that a lot of you are willing to help each other. I hope that this method will spread out for everyone. You can discuss all cases that you want in the group. Okay, I'll send you an email, send you the presentation in PDF file, and I'll send you the link to watch this, rewatch this webinar, and I'll also send you a link to invite you to a Facebook group that you guys can discuss any cases in the group. Okay, again, I don't promise I will give you the answer in the group. I just give you the opportunity to discuss any cases in the group, because I'm so busy and I don't promise that I will give you all the answer. Thank you for all your time and for all your effort and trust me and support me tonight. And the last thing I want to tell you is that is not complete balance method acupuncture. This is just local balance, and it's just a little part of local balance. But I'm sure you get instant relief in your clinic. Okay, I guarantee it. I'm not guarantee you're gonna get 100%, but when I learned it myself before I went to the seminar to attend Dr. Tan's seminar, I actually get 50% results in my clinic by just reading Dr. Tan's Acupuncture 1, 2, 3 books. After I attend the seminar, the result is phenomenal and at up to 95. And I keep doing Acupuncture 1, 2, 3 for 1.5 years without using any other method until I sure that, yeah, I got it all right. And now I need to learn something more to cover the short part of Dr. Tan's balance method. As I said, the Dr. Tan's balance method can't treat all structure issues. So I went and find out that there's something called GE acupuncture, which I call foundation acupuncture. It can treat a lot of structure issues by using needle. Most of the time you have to use tuina or massage. And we are so lucky because we know Chinese, we understand Chinese, and the master actually come next month to teach GE acupuncture. I'm going to join that as well because I invite him to come. And I actually went back to Malaysia to learn, to attend the seminar. And I'm going to do a seminar in Chinese of GE acupuncture. I know a lot of you speak Chinese too. So next Friday, we're going to meet in here from 8 to 10 o'clock. I'm going to present GE acupuncture to introduce how GE acupuncture can get to treat lumbar herniation disc issues, and how you can just by so okay, sorry, are you guys still hearing me and can see me? Because I see that my okay, good. So next Friday, and I actually would like to do an English as well for GE acupuncture, but I have to get my material on my presentation into English first, because so I will apply a CPD and to make a time to talk about GE acupuncture in English. Okay, I have got the permission from Master Liu and allow me to introduce GE acupuncture. But first, we're gonna introduce in Chinese next Friday from 8 to 10 o'clock. Now, if you want to know how I Ching Bagua balance, okay, how you get all the balance system from Bagua and global balance, and core foundation class normally take about 4 days and 6 days for advanced class. Okay. Again, I don't teach in workshop. I only treat in webinar at the moment, and I actually have Chinese webinar, and we have 200 something people in 1 month join in to learn. Okay, I'm planning to present a webinar for the co-foundation balance acupuncture. It's a webinar one. If you want to join in, of course, you have to pay for those. Okay, I'm not gonna do free for those. Okay, because it will take me a lot of time, and you're gonna do it step by step. You're gonna learn more. Okay, and this is only 2 systems. I'm gonna introduce 6 systems, and I'm gonna introduce what about if a lot of pain in different area? Can you a lot of meridian? Can you just use 1 or 2 meridian to cover 6 meridian, 5 meridian, so you don't have to put a lot of needles? Okay. The next course, GE acupuncture, I would like to do it on a free to introduce GE acupuncture and introduce 4 points of GE of acupuncture. Then you can try on to use it on any kind of lower back pain. It will get instant relief and a good result, and also can use those 4 point for lumbar hernia, this herniation problem. Okay, it's great. So you'll be able to do that too. But I haven't got time to make all the Chinese material into English yet. When I do it, and I'll announce it. So you better go to my my Facebook group, because I will announce over there when I'm ready for teaching in English for free. For the Chinese acupuncturists, next Friday I'm going to teach free webinar on G acupuncture. Okay, so thank you guys, and thank you for your time and to listen to me tonight. And I'm so happy to see you guys still here, and you guys are awesome. And please join the group, and I'll send you all the email, all the material, I promise, but it take a while. And all right, any question actually before I close it up? Any question? There was some question. I got your email, so I'll send all the material to your email. I won't send it into a Facebook group. Okay. Good point. Good point. What if we don't get the RC points? What if we don't get the RC point? Well, you needle it. You still needle it. You don't needle the RC point. You needle the image. You needle the mirror. You needle the area. And you ask the patient, how deep is the pain? You insert needle first. If the patient's pain is still there, insert deeper. Even touch the bone, even touch the joint. Okay. If the area over here, there's a lot of tendons, you're going to needle the tendon sometime. Okay. So use muscle to treat muscle. Use tendon to treat tendon. Use bone to treat bone. Use joint to treat joint. This is another holographic theory. Use skin to treat skin. How deep? Up to you. You needle, you ask the patient, where is the pain? If the patient say no pain, you got it right. If patient said pain, deeper. Okay. There's some case of when you needle it and the patient saw no pain and you walk away, you come back and the patient pain come back. What do? Go deeper. And a lot of time you may see that when you come back, the needles pop out. You just put it in again. Thanks so much, Szenan. Yes, it was about stiff shoulder muscle. How can we reduce the stiffness and pain? That's great. So how many meridian involved with stiffness? Because stiffness is not, sometimes it doesn't actually tell you just in here, like pain. It's go along. So treat those 6 meridian. Treat those 6 meridian. What is this registration link? You don't need to get a registration link for this one because I got all your detail, and I'll say I got your email. When you come into this platform, you have given me your email. Okay, any question? Do we get the registration link this time as well? No, you don't. There's no registration link today. I'll send you the CPD certificate anyway. What's the anal balancing point? Good thing. Okay. The anal is over here, right? Where's the opposite? Top of the head. So you're gonna go to here, do meridian to find the answer point. Okay. And if you want needles, the mouth, that's okay too. You eat from the mouth, you come out from the anus. Yeah, your poo come out of the anus. So anus, treat mouth. Simple, right? But it's so painful over here. How do I image occipital area? Okay, on wrist and ankle. Okay, good point. Good point. Okay, good question. Very good question. Occipital. I did Chinese webinar, this one, same topic, last night. And one of the acupuncturists asked me about occipital as well. Now, occipital is what meridian? Do meridian, right? And you want a needle here. It's very difficult and awkward, right? So where do you needles? Simple. You needle here. 鸠尾 sternum bone. When our sternum bone, there is sharp one like so. It looks like occipital triangle. You needle and touch the bone. 鸠尾 point over here. Or 剑突 over here. Then that can help occipital pain. And another area over here on the head, over here, you feel, I don't know what they call it, called 粗龙in Chinese. It came up with a pointy bone over here. I really don't know what they call in English. I'm sorry, but you get me, right? Can you not see my question, please? I don't see your question. What's your question, Richana? Did you put a question on here? Oh, can we needle more points? I've seen your question now. Can we needle more points at a time? Does it give fast result? Thank you. Yeah, good. You can do that. No problem. Now, Dr. Tan said, if one point work, you don't need to needle more point. But this is we talk about strategy. So in acupuncture, you really need a strategy. What is a strategy? When do you needle more points? We talk about 4 areas, right? Can you needle all 4 areas? Yes, you can. But if you needle one area, it works beautifully. Do you need 4 areas to needle it all at the same time? No, you don't need to. So how do you know? If you ask me, my question is, I don't know. Okay, to be honest, I don't know. And how do you know? Because everyone's different. Test it out. Give it a guess. Give it a test. The first time pain over here, you needle here, right? You just needle one area. If it's work, no pain, that's good. And the patient walk out and come back next time, and you ask the patient, how long did it last time? Oh, it lasts 1 or 2 days. That's great. Keep doing it. Oh, no, it doesn't work well. It was good by the time you take out the needle, and after 2 hours, it came back. But we know this point worked. So needle here, and then now we needle here. We needle another area. We needle another area. My mom's calling me. Okay, we needle another area. That's simple. 馬雲啊，講佢等你拍好了。 Okay, so does it make sense? Is there any point to stop the pain on right middle of the thumb? Thanks. That's good. Yin or yang? Yes. You use fingers to treat fingers. You use the opposite side. When you needle the thumb, it's gonna be painful because it's so sensitive. So you use very thin needles on it. Okay. Anything else? Get between two sessions. Don't understand that? Prakash, not sure. Martin, this is a tricky part for me. For example, the lower tip of the scapula. To be precise, the muscle under the scapula. How to mirror image? Good question. I don't have the skeleton in here, otherwise I can show you. So, scapula. Scapula is triangle, right? You needle 八髎bone in here. On the tailbone, in the pelvis over here, is you needle over here that can treat the scapular bone, or the underneath, or you just treat the opposite side of the scapula and the muscle underneath. Just treat the opposite side, or treat over here, this area. Can you see it? Cause my okay, can you see it? Thank you. Yeah, that's it. You're welcome. Any question? I think I need to go. I need to close down everything because I need to answer my mom. My mom just called me. And last question. Okay, when we should go for second treatment after how many days? Well, it's up to you. You ask the patient. In our clinic, every 2 days. So once every 2 days, once every 3 days, depending on Dr. Tan suggests 3 times weekly, and then you cut it down slowly, or 2 times. If it's very bad, every day. If it got result and you take out needles, it comes back again very quickly. Then twice a day. In China, they do twice a day, and they do every day. Okay, you're allowed to do that, but in here we charge higher fee. I treat my patient. I see them once a week with Chinese herbs. Okay, because I use acupuncture spirit, and I'm able to, I use Chinese herbs to treat meridian issues. When I look at the meridian and I know which herbs to give them, I still use meridian to diagnose using herbs. I have a system from needle, choosing the point, using meridian diagnose, and herbs will come. If my needle's working, then herb will definitely work for that one. It's amazing. This method called acupuncture spirit. Using pose, it's easy. And I actually introduced it in English my video if you search on Google. Winnie Her, where is your question? I can't see your question. Okay, yes, I missed it. I'm sorry. How should we treat if the pain keep moving from one point to the others? Now, good question. Chasing the pain. Keep going for acupuncture 1, 2, 3, acupuncture 1, 2, 3. Okay. When you got used to it, this is how, when you come to my class webinar, I'll show you how to treat, how to chase the pain, and how to prevent. You don't have to chase the pain. You needle, that's it. If the pain, you say patient pain still there, and it say, oh, it's a lung meridian. Now you over repeat again acupuncture 1, 2, 3, and we say the pain's over here now. Then you acupuncture 1, 2, 3 again. If the pain over here, acupuncture 1, 2, 3. Of course, you end up with more needles. Okay, you end up with more needles. But hey, patient doesn't care how many needles you put in. They only care whether you can help me or not. Okay, I know people said about if you use one needle to fix everything, that's good, but that's not in the case. Okay, if you can use one needle to fix everything, that's great, but not in the case. We are not there yet. Did I answer your question, Winnie? So chase the pain. Or repeat acupuncture 1, 2, 3. Okay, and put more needle in. Thank you. You got it? Great. Thank you very much, and I hope you guys have an awesome weekend. And I have to go to the temple tomorrow morning at 6:30, and I have to go now. And you stay awesome, and I love you all. Bye bye. I'll see you next time.